Thank you for your time in viewing this presentation on HPV awareness. What I would like to accomplish in this presentation is to first introduce who I am. I will go over information about HPV, including what HPV is, statistics, why some people do or do not vaccinate, and preventions that can help reduce contracting HPV. My name is Jennifer Robbins. I am a new graduate, having received my Associate in Applied Science in Nursing December of 2017. I officially became a registered nurse beginning of February through the Arizona Board of Nursing, and as of April 9th, I will be a new employee of Banner Desert in the Progressive Care Unit, which I am really excited about. The reason I'm doing this presentation is because I'm currently working towards finishing my Bachelor of Science in Nursing with a graduation date of May 2018. This presentation is the final project to achieve this degree. In the last 2.5 years of being in the program, we have been working on assignments that heavily focus on nursing research, discovering topics, reviewing and analyzing studies and papers, and making sure that we can find credible resources for our own community outreach projects. A nursing capstone challenges us as students to present our studies to help impact the community in a positive way. I have previously researched HPV, and I knew that this was a topic that could really benefit from bringing awareness to the community. The reason I chose the topic of HPV is because I am a victim of it. At the age of 23, I was diagnosed with precancerous cells in my cervix that evolved from the HPV 16-18 strains. I will go more into what these strains mean here shortly. But these precancerous cells were growing so fast that my doctor gave me 5 years or less until I had full-blown cervical cancer if the cells were not removed. During the age in which it was recommended to receive the HPV vaccination, I did not receive it due to lack of information. The vaccination was very new at the time, so my parents and I were skeptical to receive it, as I'm sure you may be today. Fortunately for you, the same challenges that I had when I was young have been settled, and I'm here to help provide you with sufficient information about HPV to make a more educated decision. I know that if I were aware of the statistics and known the benefits of the vaccine when I was younger, I would have opted to receive it and might have never needed surgery to have precancerous cells removed. What I'm expecting to achieve is to spread awareness about the effects of HPV and facts on how to prevent it. I also want you to understand that I am in no way wanting to pressure or sway you to vaccinate or not vaccinate your teenagers for HPV. At the end of this presentation, I do have an evaluation form I will ask you to fill out that will help me to evaluate the success of myself as the presenter and the presentation. HPV is short for human papilloma virus. What most people do not realize is that HPV is the most common sexually transmitted infection, or STD, in the United States today. HPV is transmitted through intimate skin-to-skin contact. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. HPV can be passed even when the infected person has no signs or symptoms. In most cases, HPV goes away on its own and does not cause any health problems. But when HPV does not go away, it can cause serious health issues like genital warts and cancer. There have been over 100 strains of HPV discovered. 40 of these strains have been linked to genital warts, and 2 strains have been most commonly linked to cancer. 70% of the cancers caused by HPV are evolved from the 16-18 strains of HPV. Cancers that are caused by these strains include cervical, vaginal, vulvar, penile, mouth-throat, and rectal. According to the Center for Disease Control and Prevention, or more commonly known as the CDC, 79 million Americans are currently infected with HPV, and most of them being diagnosed in their early teens or early 20s. That is, 1 in 4 people in the U.S. are currently infected with HPV. Statistically, 14 million Americans become newly infected each year. And every year, 30 million new people develop cancer that has evolved from HPV. It is so common to contract HPV that nearly every man and every woman have had it at some point in their lives. Before HPV vaccinations were introduced, roughly 340,000 to 360,000 women and men were affected by genital warts caused by HPV every year. Based on research data from the years 2010 to 2014, about 41,000 HPV-associated cancers occurred in the United States each year. Over 23,000 among women and over 17,000 among men. Cervical cancer is the most common HPV-associated cancer among women, and oropharyngeal cancers, or cancers of the back of the throat, including the tongue and tonsils, are the most common among men. Every year, nearly 12,000 women living in the U.S. will be diagnosed with cervical cancer. The human papillomavirus has been linked to nearly 99% of cervical cancer diagnoses. Even with screening and treatments for these patients, more than 4,000 of them will die each year. So after going through some statistics, let's break it up and play a game. What I'm going to do is present you with the statement. After hearing the statement, I will give you a few moments to consider if you believe it is a myth or a fact. Then we will review the answers and provide information to help clarify the statement. The first statement is, the HPV vaccination causes serious medical problems. Do you believe this is a myth or a fact? This is a myth. The HPV vaccine is a safe drug and does not contribute to any serious health issues. A 2014 CDC report, which looked at more than 67 million doses of the vaccine given between 2006 and 2014, found that only 4% were linked to side effects, the most common being dizziness or fainting after the injection, local reactions such as redness and swelling at the injection site, and nausea and headaches. HPV can be treated with antibiotics. Do you believe this is a myth or a fact? This is also a myth. HPV is a virus. While some of the problems caused by HPV can be managed with medication, there is no cure or treatment for the virus. However, the HPV vaccine can help in preventing the infection. The HPV vaccination works best before becoming sexually active. Is this a fact or a myth? This is a fact. Although your teenagers or children may not be sexually active yet, the vaccine actually works best if given before exposure to HPV or sexual contact. The vaccine also works best when given at a younger age. Research shows that younger people create more antibodies to the vaccine than those aged in their late teens. Creating more antibodies helps the body fight against the virus if infected. Only girls need to be vaccinated against HPV. Is this a myth or a fact? This is also a myth. Both females and males can get infected with HPV. About 8 to 9 out of 10 sexually active adults will have at least one type of HPV in their lifetime. Many people know that cervical cancer is caused by HPV, but there are cancers found in men that are linked to HPV infection. HPV vaccines are strongly recommended for boys and girls to help protect against HPV-linked cancers and genital warts. The HPV vaccine helps reduce the spread of HPV in both males and females. Now we're going to go over a few of the reasons why people have been against vaccinating their children for HPV. Some parents believe that you are giving your children permission to have sex because they have received the HPV vaccination. A 2012 study by the American Academy of Pediatrics compared 493 girls who were immunized against HPV to 905 who were not immunized. It found no significant differences between the groups in how often the girls received contraceptive counseling, or were tested for a sexually transmitted disease, or in pregnancy rates. In addition, children often become sexually active sooner than their parents might like to think. The average age in the U.S. for initiation of sexual activity is around 14 to 15 years old. Studies have shown that getting the vaccine does not make it more likely for teenagers to start becoming sexually active simply because they received the vaccination. Some people may have heard that the vaccine can cause the HPV infection or cancer. HPV vaccine does not cause infection or cancer through HPV. It is made from one protein of the virus and is not infectious, meaning it cannot cause HPV infection or cancer. Not receiving the HPV vaccination at the recommended ages can leave one vulnerable to cancers caused by HPV. Can HPV vaccines cause infertility in my child? There is no evidence to suggest that HPV vaccine causes fertility problems. What I would like to discuss now is the preventions of HPV. As I shared previously, HPV can not be treated, only prevented. The HPV vaccination is recommended to start for boys and girls at the ages of 11 to 12. At 11 to 12 years of age, if received, there is only 2 doses that are recommended. After the age of 14 and before the ages of 26 for girls and 21 for boys, it is recommended to receive 3 doses of the HPV vaccine. If we can remember from an earlier slide, younger people were able to create more antibodies against the virus, which is why they are only recommended to get 2 doses. The older they get, the less antibodies they create, so another dose is recommended to give them a boost of antibodies against the virus. There are a few types of the HPV vaccine, and I will discuss 2 of them. One is the quadrivalent Gardasil. This vaccine protects boys and girls from the HPV strains 6, 11, 16, and 18. 6 and 11 were linked to genital warts, and 16 and 18 strains were linked to cancer. The other is the Gardasil 9-valent HPV vaccine. This vaccine protects against 9 HPV strains, including the 16 and 18 cancer-causing strains, and other high-risk strains. All vaccines that are for HPV prevention protect against the cancer-causing strains. The vaccination is not the only way your teenagers can be protected against HPV. If your teenagers are sexually active or will become sexually active, making sure that safe sex is practiced can help in reducing the incidence of HPV. Though using condoms can lower your chances of getting HPV, HPV can affect areas that are not covered by the condom. So, condoms may not fully protect against HPV. Also, it can be helped to be in a mutually monogamous relationship. But remember, any type of sexual contact can lead to contracting HPV. Now that we understand the impact of HPV and some preventative methods, let's talk about the effectiveness of the vaccination. HPV vaccination works extremely well. Clinical trials showed that the vaccine provides close to 100% protection against precancers and genital warts. Since the vaccine was first recommended in 2006, there has been a significant reduction in HPV infections. Research has also shown that fewer teens and young adults are getting genital warts. HPV vaccine offers long-lasting protection against HPV infection. 10 years of data show that HPV vaccination provides long-lasting protection, and there is no evidence to suggest that HPV vaccine loses the ability to provide protection over time. If a choice is made in favor of vaccinating, in most cases, the vaccination is covered by health insurance. In the case that you are not insured or underinsured, the Vaccines for Children, or the VFC program, may be able to help. VFC provides vaccines for children ages 18 years and younger who are uninsured, Medicaid eligible, or American Indian Alaska Native. Most neighborhood pharmacies provide this vaccination. If you are unsure, give them a call or talk to your physician and pediatrician. My goal of this presentation was to increase awareness on HPV. Within the last 20 minutes, we have been able to increase our understanding of it. We have gone over some statistics of the effects and preventative methods of HPV. Even with the information I gave you today, I want to encourage you to do your own research on HPV to further your education. By utilizing resources such as the CDC or by searching Google Scholar to help in finding studies that have been completed on HPV, and of course talking to your physician or pediatricians, can help you in gaining more knowledge about HPV. Here are some resources that you can start with on further educating yourself on the topic of HPV. I want to thank you again for your time today on allowing me to present to you information on HPV. I hope that you feel the presentation and information I have provided with you today was informative. If so, please feel free to share any of the facts or data you learned with others. By doing this, we are helping to spread awareness to our community about the topic of HPV. Provided on the slide is a link to a survey, to provide a personal evaluation on the success of my presentation. Please know that this is an anonymous survey and honest feedback is appreciated. Thank you again and have a great rest of your day.